Hello, I'm Bridget Jimenez, and I'm taking medical terminology at TWU. I'm a reproductive endocrinologist, and I have dedicated myself to diagnose and treat patients struggling with particular abnormalities due to infertility. Specifically, I have treated patients who have been struggling to get pregnant for a long time period. I have done research relating to this health issue of infertility for 10 years in a row at the Laredo Medical Center. Based on our evidence data, we have found that 60% of our women patients from ages 15 to 44 have difficulty getting pregnant or staying pregnant. Most of these women have demonstrated common symptoms within each of their unique experiences. For instance, some of the symptoms are irregular menstrual cycles, thyroid abnormalities, amenorrhea, and 2 or more miscarriages within 2 years or less. Also, the levels of follicle-stimulating hormone, estriol, and Mullerian hormone are crucial to diagnose the success of the reproductive efforts. As a gynecologist specialist, I have always recommended patients to develop healthy behaviors, such as quitting smoking, losing weight, or gaining weight if she's too lean. Also, I will review the patient's current medications to assess if they're safe for them in order to try to conceive. And particularly, I will evaluate a woman's reproductive organs, such as the uterus, the fallopian tubes, and the ovaries, to look for abnormalities that might be causing the problem. Also, I will review the patient's family, medical history, and consider factors such as age, current health, and previous conception to determine the nature and duration of their treatment. On average, infertility treatments can last up to 6 months, up to 3 or 10 years. It all depends on the problem. We have a particular patient in our healthcare facility. She was a woman of 35 years old, and she had 3 unsuccessful pregnancies within 3 years of trying to conceive. She is a kindergarten teacher who has been teaching more than 10 years, and the idea of maintaining a successful pregnancy has caused her depression. She has visited previous psychologists and other gynecologists to help her with her issue of infertility. For her diagnosis, we proceeded to do a physical exam to determine her blood pressure, body mass index, and overall her physical appearance. Also, we did a pelvic exam to determine or check for signs of extra male hormones, since we noticed there were some extra hairs on her face. Overall, she was diagnosed with polycystic ovary syndrome, and she had a high normal androgen hormone, and she had both of the x-rays that come out to be cysts on both of her ovaries. She was recommended to start hormone replacement therapy, such as the anti-androgen medicine, to block the effect of this hormone and to help reduce the extra hair on her face and her body. Also, she was recommended to take home steps such as losing weight, to lower her blood sugar levels, and to develop new healthy eating habits to help her improve the way of her body was balancing the hormones. And this was the cause for her infertility. Overall, as a reproductive endocrinologist, I would recommend raising awareness of infertility among childbearing age women and how that can lead to up to polycystic ovary syndrome. I want to also raise awareness to emphasize more on how to treat it or how to improve the chances to obtain a successful pregnancy. And I know there's still more major problems that we need to focus, such as the effectiveness of current use of medicines and supplements to restart the ovulation on patients who are diagnosed with polycystic ovary syndrome. Thank you.